Welcome to Caring Through Cancer, a series by the Mary and John Elliot Charitable Foundation, bringing together voices of care who help to shape the cancer journey for patients of the Solinsky Center for Cancer Care at the Elliot. Thank you for joining us as we walk this path together, one compassionate conversation at a time. I'm with Katie Hall. Katie Hall is the Thoracic Melanoma Oncology Nurse Navigator at the Solinsky Center for Cancer Care at the Elliot. In Katie's role, she assists with care coordination and serves as a point of contact for patients newly diagnosed with lung cancer and melanoma. With many moving parts in the sphere of a cancer diagnosis, Katie also helps with education, advocacy, and ensuring that patients are well supported through their journey. Katie serves her patients with compassion, dedication, and a wealth of clinical knowledge. Katie consistently pursues professional development opportunities and is on the board of the Northern New England Clinical Oncology Society. Katie, thank you for joining us.
Thank you for having me.
Katie, tell me a little bit about yourself, your nursing career, and how you arrived in oncology services.
Yeah, so I've been a nurse for 20 years. I started my career in Denver, Colorado, working on a medical oncology inpatient unit. And then I quickly realized that oncology was a passion of mine. I've been in a dedicated oncology nurse navigator role for 10 years. Okay. And, I've always loved working with oncology patients. My entire career is dedicated to oncology, and I love it.
What drew you into a nursing career?
So nursing career was probably my father. He was diagnosed with non-Hodgkin's lymphoma when I was a freshman in college. And so, during his time through treatment, and he ended up in Boston with a stem cell transplant, I remember him speaking accolades of a nurse that worked with him closely, gave him support and guidance and education throughout, before, during, and after his transplant. And, I just remember him really enjoying that, that one-on-one time and being able to have that support during a difficult time. So I'd like to think that that's, what I've become for my patients, and that I offer them a sigh of relief, when I tell them that I'm going to be their nurse navigator and helping to, be their support person.
Oh, that's pretty awesome. Where did you go to college?
So I went to the University of New Hampshire in Durham, and then, in 2005, and then moved to Colorado.
Okay.
And then back home, of course.
It's fantastic that, so did he tell you the nurse's name? Because I'd like to give her a thank you for inspiring you. Because you've been somebody that our entire team draws inspiration from as we learn about, the different, some of the amazing things that our team performs. And I think, so whoever that person is, I'm going to give them a shout out for being an inspiration to you. Mm-hmm. And so tell us a little bit about, Nurse Navigation or Nurse Navigator is something that we're starting to hear in the healthcare lexicon or, oncology realm a little bit more frequently. And we see different places stating that they have nurse navigators. Now, I have to tell you, I've had the luxury of having a couple conversations with a few of our, one of our team members, one of our someone who was a family member of a patient who had services from the Solinsky Center for Cancer Care, and everything that we learn is just amazing in terms of the support that we provide. In those conversations, I've shared with them that I lost my father to cancer, which it'll be 6 years, and he was in Florida and didn't have any of the amazing support systems that our teams provide. And that has been kind of an inspiration for me as I get to work with you and maybe help support building some of those programs.
Absolutely.
One of the things that I really wish that he had was nurse navigation, just the complexity of care, the confusion, the questions that we weren't sure of. What do we do? Where do we go for certain things? And the services were fairly fragmented. We hear that term nurse navigator, and at that time, I don't know that I really would have appreciated what that really meant. What does that term mean? How would you explain that to someone, what a nurse navigator is, and what does that mean here?
Yeah. So a nurse navigator is really designed to be a primary point of contact across the care continuum. So the oncology nurse navigator's aim is to, close communication gaps and facilitate comprehensive care, really while advocating, an informed shared decision with the care team. So I'd like to think that I'm, first and foremost, the patient's primary support to help communicate with the care team, working with the interdisciplinary team and being able to, provide that emotional support as well. I think that oftentimes patients don't know what to expect. So there's a lot of that fear of the unknown. So we can help educate them on what to expect and, just coordinate seamless transitions of care. I work closely with the thoracic surgeon, Dr. Quinn. And so when I started here, we implemented a pathway to incorporate upstream nurse navigation at time of diagnosis. So the hope there is that I can meet the patient as soon as they're diagnosed and connect with them and help to coordinate, the sequence of referrals and complete the staging and diagnostic workup and just make sure that they're not out there in the dark, that they know what to expect and what to anticipate in the coming weeks. While we order, additional testing and imaging and then get them lined up with either medical oncology, radiation oncology, or both. So I
it's
think,
a pretty straightforward, fairly simple job.
Yeah.
Maybe not.
I think what's unique about nurse navigation at the Elliot is that we're all disease-specific nurse navigators. So that really helps us to, focus in on a specific patient population and offer clinical expertise and knowledge about what to expect. What treatment plans are going to be recommended per, NCCN guidelines, or what tests we'll anticipate for patients, so we can help again, ease that fear of the unknown. So when we built when we started the navigation program, we had 2 nurse navigators, myself and Sam Diaz, and within less than a year, we actually doubled the number of navigators. So we have a total of 4 nurse navigators, all disease specific, and so I think that's really what helps us stand out at the Elliot, is that we're not. We work for the patient, so we're not aligned with one physician on either medical or radiation oncology. We work directly for the patient and align with the group of physicians as their oncology care team.
That's pretty cool. So you stay with the patient the whole time.
Mm-hmm.
You don't kind of interchange.
No, I mean, we really work. We collaborate with the team, and so we collaborate and coordinate, with all the different specialties to ensure that patients, are moving forward. And if there's barriers, we, work to alleviate those, or, advocate for the patient if they need something that they're not getting.
So tell me a little bit. How does it work? As soon as you get a diagnosis, are you kind of tagged in? How does the process work?
So Dr. Quinn actually gives out my business card. But when it's a referral from Dr. Quinn, typically he will notify me when we have a positive diagnosis. Okay. And then he'll, let the patient know that I'll be in contact with them to talk about next steps and to, get aligned with oncology and kind of looking at those next steps with cancer, with their care. So once we have that information, I'll reach out to the patient and I coordinate with the team to, get them into oncology and, sometimes get their, their PET or their brain MRI imaging that's helpful to have before they see the oncologist. So when they see the oncologist, it's not a matter of, if this, then that. It's more because of this, we know that. We know we're going to offer this particular regimen or this, systemic treatment.
Care, yeah.
Mm-hmm.
I have to imagine that must be, getting a positive cancer diagnosis, obviously life-changing. The emotional impact, I'm sure overwhelming.
Yeah, absolutely.
But to be that person that's kind of, hey, we're going to hook you up, not only with the physician that's going to be able to manage your care, but with somebody that's going to help make sure you have the supports around you, the other clinical pieces, and that true navigator. Mm-hmm. And I think that term navigator really means so much. Helping to guide that patient on their cancer journey really is critical. That has to be something that is, how do your patients react when they first contact you? I mean, that must be, a really impactful conversation. How do you guide your patients? And what's the experience? Tell us a little bit about that experience.
I'd like to think that it offers them a sigh of relief. I think that given our complex healthcare system today, it's very overwhelming and nothing is straightforward anymore. There's lots of, lots of variables and just complexities within the healthcare system. So I'd like to, give my patients a sigh of relief to say, if they have questions after their initial consult or, in between visits, then they can reach out to me and call. And, hopefully I can, if I don't have the answer, then I know how to find it. So I'd like to think that patients, that's probably the best part of the job. It's equally challenging as it is rewarding, but I love to get to know my patients and to be able to help them, and to help them focus on other things, beside their cancer diagnosis.
Yeah, that it's going to be so impactful. I remember personally sitting in a hospital room with my mom and my dad down in Florida, kind of going, okay, what do we do from here? And we didn't have that person to help kind of guide us. There were people trying to do their best, but the system really wasn't designed to support us this way. Is this something so this nurse navigation program at the Solinsky Center for Cancer Care at the Elliot, when this program started several years ago, seemingly relatively newer, is the level that we provide it similar to what you see in the industry now, or what makes it different?
I think, again, what differentiates us is that we're disease-specific navigators, and that even the location of our office being in between medical oncology and radiation oncology is unique, because we're not embedded into medical oncology or radiation oncology. So there's nurses that work directly with the physician. So I think that allows us to follow patients throughout the whole continuum of care, kind of from a bird's eye view, and to help follow them along each transition versus, like when we first started, there was a lot of ideas of what the nurse navigators could do. And I think that we had to have tough skin and just say, well, this is our goal. It was helpful to have Marcia Clements, our director and boss, be able to support that vision and really understand what true navigation is, which is following the patient all the way from when they're first diagnosed, to survivorship, hopefully.
What are some of the things that you've learned in the last, because I think you've been doing this for 10 years, and the way that we do it now, what are some of the improvements that you've seen in the last few years? Are there things that you've seen us do differently that...
I think that the collaboration at the Elliot is especially unique. I think that what I've learned is the importance of building relationships with people. I think that when you're working together as a team or with our oncology care team, building relationships so you can communicate, hey, this is what I need, or this is what the patient needs. Can you make that happen? So I think that once you are used to working with a group of people, you just have this understanding of what you need to help the patient, and it's a shared goal, amongst the team.
Okay. So having done this for 10 years, I have to imagine this isn't something, this is a passion and a calling now. What are some of the things that you love about the population that you work with?
So I think that what I love most about my role as a disease-specific navigator is to be able to have an expertise in lung cancer and melanoma, just to be able to work so closely with a thoracic surgeon and to have him, value my role as a navigator and to, kind of manage me up when he meets a new patient. And the same goes for, the medical and radiation oncologist. So I think that I love working with the team. I love working with the team that values and supports the navigator role and kind of helps to bridge the gap between, things that might have been missing before.
Thank you. As we think about the work that you do and the passion that you bring, I have to imagine it is life-changing to those patients as they're going through an incredibly difficult time. And to have you there as a partner in that journey must mean so much. Is there an example of a case or a family or situation that comes to mind that you really, when you go home, you think about, this is why I do this job?
All the time. I mean, I can think of...
Do you have one that stands out that you might be willing to share?
Yes. Let me just think for a minute. There's so many. I guess, and I don't know if you can talk about it, but a lot of it is actually when patients near end of life. And, obviously that's not always the case. And we strive for, for long great quality of life once you have a diagnosis. But a lot of it is just being able to bond with patients and to know them from the very beginning when they were first diagnosed. And being able to be that support for them when the time comes that they might need to make that decision to transition to more of a comfort focus. Because I think those would be hard conversations to have if I didn't know them well. And some of the patients that have unfortunately passed on, I still speak to their spouses and, still, communicate with them not all the time, but, you develop a special bond and relationship with these patients. So I don't know. I mean, it's not a very specific example, but I think in general, it's just knowing them through the whole journey, which I think is a really special and unique opportunity.
So you've touched on a few of the different elements within the health system that you help kind of coordinate people and navigate their journey. What are some of the, I think you've touched on, so our palliative care and others. What are some of the key healthcare providers or different groups that you typically work with, and what are some of the ways that you help navigate that care?
So that's a great question. We have at the Elliot, we have a cancer support services, so that encompasses our dedicated oncology social worker, our registered dietitians. There's actually two social workers and 2 dietitians. We have a financial advocate. We work very closely with palliative care. So essentially, this whole support service group is, resources for our patients. So when we first meet patients, we'll address, various barriers, whether they have transportation barriers or financial distress, or perhaps some food insecurity or just emotional distress. And based on our assessment, the navigator then can pull in the appropriate resources. So that's, our oncology social worker, or if they're having, dietary concerns or how to, different tips for tolerating treatment, we can pull in our dietitian. So again, it's not always what I know, but it's who we know, making sure we pull in those right resources.
Now, when you coordinate or you navigate, do you typically work with patients outside the system into different resources outside of the Elliot, or?
Sometimes. I mean, mostly it's there's different like grants and things that our social worker can help patients apply for. The Joanne Drewsy Foundation has a grant for patients. So there are some things outside of the Elliot Cancer Center, but mostly it's within the system.
Okay. You talked, I think, specifically about the importance of a disease-specific navigator, and that you work for the patient. What are the other, there's 4 of you?
There's 4 of us.
What are the other disease-specific navigators focus on?
So by name, we do, so I'm obviously lung and thoracic. We have a GYN and breast navigator. Okay. We have a head and neck and prostate, or GU, nurse navigator, and then our 4th navigator follows malignant heme and GI. So like your colon cancer, rectal cancer, prostate, or pancreas.
Got it. Okay, and that's grown pretty significantly in just a few years.
Yeah, when we started, there was just 2 of us, and we followed all patients, so that within less than a year, it doubled, and so then we had 4. So we've had 4 for about 3 years or so.
When you first started, and we started, I know you helped us build the nurse navigation program. And what were some of the things that you and Marcia and the team had to work on to build? What's different now than when you started?
Oh, that's a good question. A lot's changed. I think that when we first came in, it was kind of like a needs assessment of first understanding the Elliot system, kind of a who's who and what do you do. I think describing the nurse navigator role, and a lot of it was just over time, we were able to build a rapport with all the different, physicians and ancillary staff, and, kind of gain credibility, so to speak. So, it used to be we would kind of, be chasing down the patient when they were first diagnosed or when they had like an initial consult, but that now the oncologists actually come to find us. So, they'll talk about us in a consult, and they'll come to find us, which is, it feels good to know that you're a valued member of the team, and you're, you're being kind of managed up, as I had said before, by your colleagues, just to be able to help the patient. And I think that they trust what we're, capable of as far as helping the patients and guiding them through various, various transitions. And I think a lot of it is just expediting care, making that phone call to say, hey, almost expressing the sense of urgency for a test or for a procedure, just to help kind of push things along. Because a lot of times things just kind of sit, and if there isn't someone pushing it along, then it doesn't always go in a timely fashion.
So you can kind of help them progress through the system and get those needs. You mentioned Dr. Quinn, who is an amazing surgeon and quite the champion for the Elliot, of the Solinsky Center for Cancer Care at the Elliot. In conversations with Dr. Quinn, I know he's made a comment to me of, other places say they have nurse navigations, but they don't have what we have.
Yeah.
And I've heard that a few times. So how would you? What is different about the Elliot? What are the things that you think that you provide as a nurse navigator that are really special and that really make that difference?
I think it's really just that we aren't embedded into a medical oncology practice or radiation oncology, so we are kind of upstream as far as when we're meeting the patient, and we're not necessarily the right hand man or woman of the oncologist. We're kind of just following along. So I think, again, what differentiates the Elliot is that we're disease-specific navigators, and we're following along from the time of diagnosis and just making sure that things are going smoothly. So there's not always, if we're connecting with the patient, sometimes there's not a need, and sometimes we're doing a lot of things behind the scenes, but ideally we're, meeting the patient and just having them know that we're there to support them and be a resource for them. I don't know if I answered the question, but
no, I think you did. I think as we think about the fact that that you work for the patient, and not for a specific office, or you're not just part of the staff. You're really dedicated with a disease specific focus to that patient. That's I have to imagine as a patient, or really as a family member to a patient, that must just be so meaningful. And I think that does make that difference. Yeah,
and I think it's easy to get pulled in kind of in the weeds, and your bandwidth is only so great. So it's hard to be successful in a role if you're being pulled in too many directions. So I think that's what helps make it successful.
So in terms of being a nurse navigator, can any nurse be a nurse navigator? What does it take to actually be a navigator? Are there different requirements? How does one move into that field outside of just being super passionate?
I think, I don't think that anyone could be a nurse navigator. I think that you definitely need experience in oncology. I think that you need to be, well organized. You need to be able to work autonomously. I think that you do have to have that passion to, help people and be willing to work through challenges and, have that perseverance, so to speak, just to help, because it gets frustrating, in the healthcare system. But I think another unique thing about the Elliot, or at least one of the requirements for our job at the Elliot, was to be master's prepared. So all the four navigators all have our master's degrees. So that was something that we all started pursuing when we began working, and we've all completed it. But that's not the case everywhere. I mean, sometimes when you see, you see a job posting and it says, 1 year of oncology experience required. Like I look at that and I'm like, how can that be? I just can't imagine being, a successful navigator, or being able to make a difference without having that oncology experience. So even just having inpatient experience and case management experience, or whatever it is, just to be able to understand the full picture, because we're following along each modality. So it's not just one episode of care. It's throughout their surgery, their radiation, their chemotherapy, all the different modalities of treatment. We need to have an expertise in all of that.
Sure.
But we also rely heavily on our radiation oncology nurses. They have the area of expertise for radiation. So oftentimes we'll defer to them, if there's a question that, again, isn't, in my scope or of true understanding, then I would defer to the radiation oncology nurses. So they're an important piece of the team too.
Yeah, it's a really well-oiled machine. I know, we talk to our providers and our teams, and the thing that we consistently hear is the difference that we're able to make because of that system, because of that design. And I think, the when we think about that differentiation, you're kind of that quarterback for the patient, right? And understanding how are you gonna, help them drive to get what they need.
Yep.
Understanding the physician's orders, those other pieces, and that master's level education, as well as the experience, really is critical to being such a great advocate for those patients and their families.
Yeah.
So one of the things, another term besides nurse navigator that we hear in healthcare is the term social determinants of health. And, we often think of what are some of the things that are going to impact a patient. And, most of the times from a medical standpoint, from a healthcare standpoint, we think of the clinical impacts or those objective measures that are likely going to impact a patient's outcome. But what we've come to find in the last several years is that the social determinants of a patient's healthcare play a significant role. What does the term social determinants of health mean to you, and how do those things impact your role as a navigator within the oncology sphere?
Yeah, so I think certainly social determinants of health play a big impact on our patients, and I think oftentimes patients present with a lung cancer diagnosis, but it's really everything else that's going on in their life. So, their lung cancer diagnosis is new and it's scary, and we're going to help them through that journey. But oftentimes, they're coming in with food insecurities, or they're, having difficulty managing, childcare, child support when they're coming in for their appointments. They don't have reliable transportation. So a lot of those things, of course, play into how are you going to get in for your treatment, and how are you going to cope with it, emotionally, psychosocially, from that standpoint. So that's where it's nice to have our cancer support services, and to be able to pull in those resources for our patients and to, help them get through that.
So when you see a patient and you see that they have different social determinants or different needs, what tools do you have at your disposal? How does that impact how you view that patient or how you manage them?
It doesn't necessarily impact how I view the patient. I mean, every patient is the same in terms of we would care for them, no matter what they have. I think it can be a little bit more challenging, just if a patient is having transportation barriers. But we have a contract, I guess, with Uber Health. So that's something that we're able to help patients to utilize, getting them to treatment. So if they have daily radiation treatment, that's something that we can oftentimes help them with. We have the Charitable Care Foundation for patients who are having some financial distress. So we're able to help, guide them into that direction. The social worker is typically involved in that, in that aspect of things. But we also have a food pantry for patients that they're having food insecurity. So that's a new thing that we've developed. So it's just nice to have all of these options. When a patient presents to you with, something that they're struggling with, it's so nice to be able to say, hey, we have a resource for that, and to get them, what they need. So I think in a previous cancer center that I worked in, we didn't really have those resources. So it's hard to listen to someone talk about, oh, well, gosh, I don't have this, or I'm struggling with that, but not be able to offer them anything. So that's I think, great. What's great that, we have those resources here.
Excellent. How do you connect with cancer patients across all points on the cancer journey, from diagnosis through survivorship?
So typically, we would meet them upon initial consult with either the medical or radiation oncologist. Ideally, there's a phone call before they come in for consult, just to explain, what to expect, with their upcoming appointment, and some things that might happen before they see us. And then essentially we're meeting them, sometimes at the teaching session, and then we'll meet with them periodically throughout their treatment journeys. Sometimes they'll get what's called neoadjuvant treatment, so they'll get treatment before surgery. So we would help, get them to the start of that treatment to surgery, and then a touch point would be at their surgery, either before or after. So we, it's kind of designed, again, being able to be at that bird's eye view to follow them along each transition and make sure that those are seamless. So whether that's a communicating with the other care team to make sure that, we're all on the same page as far as next steps and the timing and the sequence of appointments.
So since you've been doing this in the last few years working here, is there a case that comes to mind that, you go home and you think, I'm really proud of what I did today? And that's, you reflect back on why you got into nursing and the experience that you had and kind of, you know what? That's kind of why I do this. Is there something that comes to mind that you might share with, our audience?
Yeah, I think that words of affirmation is one of the love languages. And I think when I hear from patients, when they say, gosh, Katie, you've been so helpful. We really appreciate your guidance and your support. We don't know what we would do without you. One patient said that I was the light in the storm. So when you hear things like that for patients, it really is rewarding to hear, patients praise you for supporting them and being able to help them during a vulnerable time. So I think that's where the connection comes and how sometimes it can be hard, if the ending isn't what we want it to be.
I would imagine you have, with the population that you work with, there are some heavy cases and there are some challenges.
Absolutely.
How do you and your peers support each other, as you're going through, as you are an advocate for the patient and you work for the patient along their journey, I have to believe that you create significant relationships. And when they are going through challenging times, as a provider, we're impacted, as well, and emotionally trying to support them. How do you and your peers kind of support each other?
I think that it's a shared experience a lot of times. We're all here for the same reason. We're here to help our patients. So when something isn't going well or if a patient is experiencing a difficult time, we lean on each other, even if it's just a good cry or, an embrace, just to be able to carve out that time and carve out the space to grieve or to feel emotional response to, it's an appropriate response to feel like you need a minute just to kind of gather your thoughts and just, compassion fatigue is a real thing. That's another big buzzword. Just because you can become fatigued from, caring so much and giving so much. And so you just need to make sure that you're kind of filling your own cup and staying, staying present with self-care and making sure that you're doing that alongside of, your job.
Yeah. What are some of the things that you've learned about the role or things that you've seen in terms of the navigation programs, something that you feel like, wow, this is something I wish I knew, a few years ago?
I'm trying to think here. I think that I feel like we kind of went over this. I think it's just, building relationships with people. So being able to, to get to know the oncologists that you're working with, the surgeons, getting to know the people and, whether it's scheduling, procedures and interventional radiology. I mean, relationships are so important, just to be able to make sure you can help your patient and get to where you want to go in helping them.
If you could leave us with one tactic that you thought people could adopt to support someone in their life with cancer, what would that be?
I would say to remember that their illness does not define them. That if a patient has a cancer diagnosis, that doesn't define them, and to help, be an active listener, when needed, and to show empathy, but also to help them, remind them about the things that they love and, to enjoy their hobbies and to not completely, avoid those things. So just remember alongside of their cancer treatment, they can still, do things and enjoy their family and to really embrace those memories and just to be able to enjoy life alongside their treatment.
That's great. As we think about the different programs that you've been involved with, if you could share something about the Solinsky Center for Cancer Care that you think, geez, I wish everybody knew this, or, these are things that I wish other people could see. Is there something that comes to mind that you would want to share?
I think the Walk for Hope. I think that, when it comes to our cancer center and being able to, pull in our community and our family and friends, I really enjoy participating in the Walk for Hope. I think it's a wonderful opportunity to, support our patients and honor, in loving memory and honor of patients that we've lost. Last spring, we had the Walk for Hope, and it was actually raining. And so, but everyone showed up. We were all there, rain or shine. I think it was just a really telling, experience that no matter what, we're going to be here for you and we're going to support you. So I think that if I had to say something, unique to the Elliot and to the Solinsky Cancer Center, it would be our walk. It's a great opportunity.
That is
event, I should say.
That is a great reminder. And, it also talks a little bit about one of the things that I think is sometimes that we have a real opportunity to celebrate, and that is our community. Mm-hmm. The community around the Elliot has just been so important and impactful. We do a lot with philanthropy, mm-hmm. and we rely on some of those things. What are some of the things that you've seen that the relationship with the community and some of our philanthropic efforts have helped support that you've been able to touch or to provide or direct patients towards?
Yeah, so I know, some of the things that I'm involved in is our November is Lung Cancer Awareness Month. So we have a lung cancer screening event, usually at River's Edge, where we have the big blow-up lung and, can offer education and resources to patients to talk about low-dose lung cancer screening and, how to detect lung cancer earlier. There's also a skin cancer screening event, so we provided education and, goodies like, SPF and sunscreen and various skin products just to help remind patients that, for the melanoma population. So I think just being able to do a community outreach and educate the population and educate our community members about the various things that you can do to prevent cancer, I think that's where we need to be. Awesome.
Well, Katie, before we close out, is there anything else about Nurse Navigation, the Solinsky Center for Cancer Care, your own career that you would want to share with our audience or something to kind of take home?
I don't think so. I'd like to think that my dad's proud of me, to be able to see that I'm doing the work that I'm doing and being able to help patients. So, I know that I was put on this planet to be a nurse navigator, and I'm just so passionate about it. And I hope that, this inspires maybe other young professionals to focus in on a specialty that gives them passion.
Well, I'm glad that we have you as a nurse navigator here doing it for our patients for the Elliot. Katie, thank you for joining us. It's been another inspiring conversation, and I thank you for doing this.
Yeah, thank you so much for having me.
All right.
I appreciate it.
Thank you, everybody. That's the end of our episode. All right.
Thank you so much.